So we've got Ed from Otto to talk to us about his journey as an entrepreneur. So hopefully this will sort of bring a lot of what we've discussed this morning to life. So yeah, really glad to have him with us this morning to join us to discuss this. So without further ado, I'll pass you over to Ed. And yeah, so thanks Ed, over to you.
Thanks, Joe, and thanks for having me. Let me just get my screen right. Okay, you guys got that? So yeah, so hello everyone. My name's Ed. Joe's very kindly asked me to speak today and tell you guys a bit about my experience with Otto, my startup. I'm just going to sort of take you through the story of how it happened, how I came about to be in this position. You know, so I'm a clinician as well, a medical doctor, so I'll sort of go through that. Take you through my career up until the point where I decided to take the leap. What made me do it? What sort of influenced my decision making then? I'll then sort of we'll quickly go through sort of the journey with Otto and how it's come about, and then just sort of some lessons that we've learned, and basically we've made a whole load of mistakes that if I was doing it again I wouldn't make, that I'm hoping that will be helpful for you guys. I think I'm talking to one, but we'll try and keep it interactive. I'll just say if anyone wants to stop me and ask any questions, just either just interrupt me. It's no problem. And then we'll have a few minutes at the end for questions as well. I'll probably be talking for about half an hour. I mentioned I'm a medical doctor. So I graduated in 2015, and during my final year of medical school, I joined the Royal Air Force, and part of that went down to work in Birmingham as a doctor in Birmingham. So I spent 2 years in, which is probably the link to the West Midlands actually, 2 years at the Queen Elizabeth Hospital, did rotations in a variety of specialties, and was sort of thrown in at the deep end really, as you'd expect as a junior doctor, which was good fun. And I did a rotation, actually did a rotation in my F2 year, my second year as a doctor, as in plastic surgery. And this was great, and I fell in love with it, and I really enjoyed the operating. I really enjoyed I enjoyed everything about it really. And so from this point onwards, I became dead set on doing plastic surgery, and I was going to become a plastic surgeon, and that was what I wanted to do. So in the military, in between sort of finishing your foundation years, your first 2 years, your sort of your internship almost as a doctor, you spend a year out and time in the military. So I spent a year doing stuff with the Air Force. So I went through officer training at RAF Cranwell, which was a really interesting experience, completely different to clinical practice, completely different to medicine. Basically 13 weeks of starting off, getting thrown in at the deep end with all the green stuff, so you know, running around with a rifle, that sort of thing. A lot of drill, and actually one of the most important things I learned was the leadership lessons. So military leadership is obviously it's a certain type of leadership, but you learn a lot about your own style of leadership and how that can be impacted, and that's coming useful. So spent a year with the RAF. After officer training, I went to RAF Cosford and spent 6 months, 9 months working an engineer as GP practice. And it was during this time that I sort of started to have sort of second thoughts about, is this the right thing? Is this what I want to be doing? And I actually remember I had a conversation with a helicopter pilot, and he came to me and he said, I've got this ringing in my ears and it's been driving me mad. And that sort of got me thinking, and I thought, okay, this isn't something we really learn much about at medical school. And that ringing was caused by tinnitus, which I'll talk about in a second. Had a look in his ears, couldn't find anything untoward, and referred him to see someone. And then I saw this same guy like 2 or 3 months later, and they'd found no obvious cause, but he was waiting for therapy. He was waiting to see a therapist. And I looked into it, and I realised that for this condition that this chap had, tinnitus, can really make people's lives miserable. So tinnitus is basically defined as a ringing or rushing, roaring in your ears without any external stimulus. And it's an incredibly common condition, I realise. 1 in 8 people have tinnitus. And as I said, it has a considerable impact on quality of life. And in speaking to this chap, I realised that it was impacting his sleep, it was impacting his mental health, it couldn't concentrate, it was impacting his relationships, and it was having a significant impact, just an overall impact on his quality of life. And I thought, okay, this is crazy. This guy's waiting for months to see someone. Why hasn't he been seen yet? So I went away, looked into it. Turns out tinnitus has no cure, but there is effective treatment available in the form of something called cognitive behavioural therapy. But there's not that many therapists that are able to provide CBT for people with tinnitus. So, you know, if you're on the NHS, you could be waiting 6 months, even a year, to see a therapist. And it was this experience that sort of got me thinking about, you know, I've always sort of wanted to do something entrepreneurial, and this has got me thinking, there's a problem here. You know, this is something that's having a big impact on people, and the solution we have at the moment isn't good enough. But quickly sort of forgot about that, focused on getting into surgical training, and went back to do 2 years in Birmingham. And I did, sorry, not 2 years in Birmingham. So I went down to London, Kent, Surrey, Sussex. I did 6 months of general surgery, 6 months of orthopedic surgery, and then a year of plastic surgery. And it wasn't what I remember it, but it wasn't as good as I remember it being, basically. I just I wasn't enjoying it how I enjoyed it before. And I felt the NHS, I felt the environment I was working in to be quite, it just wasn't for me, basically. And I sort of really had second thoughts about whether this is something I wanted to be doing for the rest of my life. And it was around this time I was having these second thoughts, I got together with my co-founder, George. So George is a doctor in the Navy, had a similar experience, and actually had recently seen someone else with tinnitus that he'd been speaking about. Now, George has tinnitus himself, and we sort of sat down at a pub and chatted about it, and thought, okay, let's do something about this. Let's create a let's do a startup. And this was around. This was probably late 2019, and we started to formalize this thought process, and really start to try and get a better understanding of the problem, which I hope I've succinctly described here, which is, if you have tinnitus, there is no cure, it has significant impact on the quality of life, and there is no easy way to access affordable and effective therapy. So this was the cornerstone of what we were going to do. So the first thing we did is we charged in and said, let's build an app, let's make a therapeutic, let's build something that's going to help these people with tinnitus, which is, if you can see the second to last point here, we didn't do. So the first thing that we should have done that we didn't do was understand the problem, which we eventually got around to. And when you're understanding the problem, you need to speak to, I would probably say, 30 plus people. But you need to speak to them in a way that you don't mention a solution that you've had, or the idea. You need to understand exactly what the problem is and exactly how it affects them. So we spoke to charities, and charities helped us find focus groups, put focus groups together. I had probably 20, 25 phone calls with people that the charity had put me in touch with, people with tinnitus. So charities were very helpful. Depending on the problem, online forums are great for market research. There's always, for tinnitus, there's lots of very active online forums. But if it's another health condition, there'll be online forums where you can find people to speak to. Because of COVID, we weren't able to do things. I wasn't able to do things in person, but telephone interviews, they were fine. I got all the information, got all the learning I needed to do from telephone interviews. Now, I'm not sure if you guys have read the Lean Startup by Ed Farrar. If you haven't read it, I would definitely recommend it. But he talks about this idea of what we call innovation accounting, and that's basically keeping a record in an early stage, keeping a record of the conversations that you have. And you need to structure these conversations, which I quickly learn. You need to structure these conversations in a way that you're asking the same things and you're asking them in the same way. And you need to be it's very, very easy to fall into the trap of asking a leading question during these conversations, and you need to be careful with that. And these conversations will come in handy later on. I suppose perhaps more relevant to healthcare, if you're thinking of considering creating an innovation or creating or starting a company yourself or creating an idea, the key thing you need to understand is who are the key stakeholders when you're thinking about the problem, and how does the problem affect them. This could be nurses. Is the problem something that's taking nurses? It's adding on 30 minutes every time they take some observations from a patient. Is that problem affecting them? Is it cardiothoracic surgeons? Is it something that's causing them some pain, causing them some discomfort when they're using a certain instrument? Is it patients attending an outpatient clinic? Are they constantly seeing a different doctor? Are they being delayed? How does the problem affect them? And which person exactly is it that the problem is affecting? Now, what's sort of relevant in healthcare is that the problem may affect two different groups of stakeholders. So with tinnitus, obviously the tinnitus is affecting the person, but it's also affecting the audiologists. The audiologists are the healthcare professionals providing care to them. So we've got two stakeholders involved, and we've only actually spoken to audiologists very recently, but we should have spoken to audiologists right at the very beginning. And I suppose that's also important because you need to think about who your customer is and who is the person that's going to be paying for this at the end of the day. And then, of course, if you're speaking to patients, it's important to be getting consent and things. But it's really important to understand before you speak to anyone, who are the key stakeholders? Who is the person that is experiencing the problem? And is that person that's experiencing the problem the same person that's going to be paying for the solution, which is particularly relevant in healthcare? So if you go to this, there was a website called strategizer.com. It's brilliant. It's got all this stuff for conducting these research interviews and getting everything down on paper. But if you think, they advise putting it down onto a diagram like this. So you've got the customer jobs, customer gains, and customer pain points. So if you think let's take the example of a nurse. A nurse's jobs could be, one of the nurse's jobs could be measuring observations on a patient. A gain could be a machine that works without breaking, or a machine that's very easy. A gain could be having someone else to do it for you, a healthcare assistant. Another gain could be or a machine that does it in a faster, more efficient way. A pain, for example, on the other hand, could be not being able to find the equipment, or the equipment breaking, or being interrupted, for example, when they're trying to do the obs. So this is a really sort of good way to get these thoughts down on paper, how to and this was really useful for us when we were speaking to people with tinnitus. What jobs does that person have? What are the gains and what are the pains? And when you've done that, it will help you to find a solution. So the solution is related to that by how it can cause or increase a customer gain or reduce a customer pain. So going back to the example of the nurses, if the machine is breaking, how could your solution prevent that machine from breaking? How could your solution mean that they're never searching for an obs machine or something like that? A simple example, but and this will really help you to think about from the perspective of the problem and from the perspective of the solution and how your solution fits. Now, this is before you've even started thinking about, this app needs to have this feature to do this. You need to be able to you need to be able to share this feature. Don't think about features. Think about it from a very top level problem solution before you go on to any of the features. And when you've thought about it from the solution perspective, that's when you can start going into the details of the product. So I'll give an example with Otto. So we've talked about the problem and the problem elements for Otto. Cost-effective treatment is very difficult to access. So from the solution perspective, it's a digital therapeutic for tinnitus, which allows instant access to evidence-based therapy for tinnitus. And you can see here I've put no more long waiting lists. So one of the pain points was long waiting lists. Well, this instant access relieves that. It's backed by science, so there's lots of crappy treatment available online, putting garlic in your ears and things for tinnitus. It's just these people are sold rubbish all the time. The benefit for them, our solution, is that it's evidence-based. It's based on the latest research. You can pay upwards of £100, £200 perhaps to see a tinnitus therapist. It's incredibly expensive, prohibitively expensive for most. So our solution is affordable. And none of these mention any of the features. So this is a really important, when you're obsessing over that problem solution, the problem solution fit, you need to be thinking about, instead of, creating an app or building a website or whatever and thinking about which features, you need to think about what is your solution going to do and how does it relate to the problem. I actually did this, we did this the wrong way around. So this solution slide, which looks so, which looks quite, it looks quite nice. I've only actually put it together after we started building the product. So don't do what I did, don't do what we did and do it the wrong way around. Do it this, because it will help you and it will help you understand how the product can help people. So you've got your problem, you've got your solution. I suppose the next step was finding for us was a technical co-founder. So the problem that George and I had, George is a doctor in the Navy, I was a doctor in the Air Force. George was a hobbyist programmer, I suppose. How were we going to build this thing? Like how are we gonna create it? And we sort of came to the point where we had three options. The first option was one of us was going to learn how to build an app. The second option was we were going to pay someone else to build this app. And the third option, we would find someone else to give equity to join the team. And we opted for option one. We wanted to do things ourselves. George already was a hobbyist programmer, so he sort of repurposed himself as a Flutter programmer, and we went down that route. George and I have known each other since medical school. We've been friends for a long time, so it should always be someone you've worked with before, or preferably. If it's not someone, or you don't know someone, then that's when you need to use your network and use things like this to be networking. So if you haven't started networking, or if you've got an idea for a product, you need to start networking if you've not got that person to build it. Don't pay an agency to build your product, because firstly, it's incredibly expensive. So you'll probably need to invest either your own money, which you should never do, or someone else's money to do this, which is incredibly time consuming. So you need to be able to have that business acumen to be able to either create something yourself or find a co-founder to be able to do that. I would probably go with finding a co-founder would be the better option. There's loads of excuse me. There's loads of events that you can go to, networking events. There's things available online. There's websites that you can find a co-founder. Just Google find a co-founder. There's loads of stuff available. Another thing I would say, it's important to work together with them on a project first, because if you decide this person is going to be your co-founder and you start working on this project with them and you give equity to them, and that person is the wrong fit for the company, you've given equity to someone, and it's very easy to give equity away, but it's very, very difficult to get it back once you've made that wrong decision. So I would stress it's important to try and get them to work together on a project before having a discussion. Just mentioning equity, we actually had a third co-founder to begin with who wasn't the right fit for the company. And thankfully we didn't have the equity discussion until we realized he wasn't the right fit, and we had to have wasn't a very nice discussion actually. And you have to be prepared to have those discussions. So you need to decide early on how you're going to divide up the company. Once you find your co-founder, you've worked together for a bit, and you need to have the discussion. Okay, well, how is this going to work? Like, what equity split are we going to have? Usually when you found a company, you found with 100 shares, and you'll have a certain percentage each. There's a number of ways of doing this. George and I went 50-50, but you need to discuss it early on and have clear expectations with that person. And you need to try and take into account, if you can, the amount of time you'll be spending on it, the expertise you bring to the table. So, is one person an exited founder before? They've worked in a startup before? Is one person, not worked in a startup before? What role they'll be doing and the risk they're taking. George and I both I gave up a career in medicine. Well, I haven't given it up yet, but I sacrificed a career in plastic surgery to do this. So George sacrificed a career in the Navy. So we've both taken a big risk to do this, and that needs to be reflected. Vesting. So if you don't know what vesting is, it's whereby you only are allowed to sell your shares after a certain period of time working for the company, and that's to stop your co-founder from just doing one day's work and walking away with his or her shares. But it's really important to find someone to speak to and get advice to about this, because equity is really important that you get it right. So going back to Otto, so the next thing we did was we calculated the size of the market, which is really important when you're looking into a problem like this, because if you've only got one person per year that could potentially buy your product, then there's no point in spending £100,000 building something that only one person is going to buy. So this is really important when it comes to raising money, and when it comes to understanding, when it comes to understanding the market need for your idea. It's all well and good coming up with an idea for the most amazing app that solves a horrendous problem, but if not many people are experiencing that problem, then the market size isn't going to be sufficient, and it's not going to be worth doing. So it's important to be able to calculate a market early on. So quickly take you through how to do this. So we used a top-down approach, and that is basically saying how many people are there in the world that might use our product. And we calculated that because we know the number of people that have intrusive tinnitus, i.e. the people where tinnitus has a significant impact on their quality of life. We know how many of those people have access to a smartphone. We know how much money we're going to charge them per year. And if you multiply those two numbers together, there's 176 million people with intrusive tinnitus and access to a smartphone, and we're going to charge them £72 per year. That means that if we were to acquire every single person with intrusive tinnitus that had access to a smartphone, we would generate £12.5 billion per year. And that's how you need to do your market calculation. Don't Google, mobile app market size. That's not your market size. You need to be thinking exactly about how many people are there in the world that would use your product, and that's the size of your market. And sometimes it takes a bit of digging to find the right numbers. You can do a similar calculation for the UK. So usually the way investors like to see is they like to see the total available market, the global market, the TAM as they call it, which is worldwide, and then limited by geography, the SOM, which is the UK, 227 million. Next thing we looked was, well, we've got this great solution that we think. Does anyone else do this? Has anyone else done this before us? Has anyone else solved this problem already? Is it worth doing? You don't want to build something that someone else has already done. And this is where this perceptual map for competitors come in. It's highly likely that someone will be doing something similar to you, but that's not a bad thing, because it depends on the way that they do it. So, for example, trainers. You've got on the x-axis, you've got expensive versus cheap, and on the y-axis, you've got fashion versus performance. And you can see how the competitors are differentiated by whether they're, an expensive performance shoe or a cheap performance shoe. And this is a way that you can use to differentiate your idea, your product from other people's. But it's important to at least have a basic understanding of what your competitors are, what your competitors are doing. What's the difference between what you're offering and what they're offering. We did it with a slightly different way for Otto. So we've just compared the features, and this is a more sort of user friendly, it's easier to understand like what the difference is between Otto and our competitors. So majority of our competitors in fact, I'll start by saying we were the first commercially available CBT based therapeutic for tinnitus. There's since been another one released, Tinabot. But whatever you're doing, you need to work out like what is it that makes your product different to your competitors, and what is it that makes your product better. What's that sort of that special sauce? What is differentiating you? Because if you can't think of anything, or there's nothing that's going to differentiate you, then again you need to go back to the drawing board and think what makes your solution the best fit for that problem. Loading time, 15 minutes. So the next step was to build the MVP. So an MVP is I'm sure you know this already, but an MVP is a minimum viable product, which is defined as a product that has the features necessary to solve a problem for a core set of users. And the key here is the key here is the word minimum. So it needs to have the minimum number of features necessary to solve that problem. Now, don't do what we did and build an app that has a load of different features that sort of solve different problems for different people and don't plan it properly. So what we did, we spent probably 5 or 6 weeks. George spent 5 or 6 weeks building a product with a load of different features that weren't tailored to the solution that we had. And if I were to go back in retrospect, we could have done this so much more efficiently and planned this so much more effectively than we did. But we just learned it because we're first time entrepreneurs, and it's just a very steep learning curve, and it's very easy to say that with hindsight. But our MVP was bloated. It had a number of features that we hadn't really understood whether it fitted the solution. So we put in this tinnitus tracking thing, for example. People didn't want to track their tinnitus. People didn't care about that, and that had nothing to do with the problem that we were describing. And what we should have done is put into an MVP purely the tinnitus therapy alone and one module of the tinnitus therapy. But we rushed into it, and we were very eager to get this problem solved. This is one of the earlier versions of it wasn't the original MVP, but it was one of the earlier versions of the app. I think it's also, at this stage, you need to be validating the idea, and there's other ways that you can validate an idea alongside an MVP. And you can do this whilst finding beta testers. So depending on what your product is, this is more relevant for consumer-focused businesses. It's very, very easy these days to host a website, build a landing page for what explains the benefits of what your product is, explains those key features. So in our case, it was instant access tinnitus therapy, backed up by science, built by experts, and affordable. So we put those 4 things onto a landing page, and then you just put a little sign up button. You don't even need to be able to. I don't code, and it's so easy to build a website these days. I'd recommend Webflow, learning how to use Webflow, just webflow.com. And you need to decide before you've built this landing page, what is your measure of success going to be? In our case, we said, okay, well, if we get 100 signups within a certain period of time with this amount of input, then that's a success. That's the beginnings of our idea validated. And it's a way of validating the idea before building a product, before spending that time, that money, that effort on building a product. You can sort of get the landing page out a number of ways. You can just pay for Facebook ads. It's so easy to go on Facebook, create a Facebook ad account, put 50 quid onto a pay-per-click thing, and people will click on that ad and go to your website. And then if people sign up, then you're onto something. It's a good idea. If people click on the ad, or if no one clicks on the ad, or if people click on the ad but don't sign up, then you think, okay, maybe we need to rethink this. But it's really important to decide on what your measure of success is going to be before just randomly spending 100 quid on Facebook ads. I use LinkedIn as well. LinkedIn social media. You can message people and just say, is this something you'd be interested in? And collect email addresses. This is important. So these people will be your first users. These people that have signed up are people that you go back to again and again to get them to use your product, to ask for advice, and to get feedback on your product. So building an MVP. So you've decided what you've got your problem, you've got your solution, you've decided what you're going to build, you've decided which features it's going to have, and you've got a list of people that are going to test it, or a list of people that have signed up for early access using the landing page. So the next step is learning how to wireframe. A wireframe is putting together, you can do this for either a website. This is a digital product I'm talking about, by the way, not a physical product, but you can put together either a mobile app or a fake mobile app or a fake website, and you can get people to, you know, click on basic links and things. And it's really important to get this thing in front of people. I recommend either of these two websites. Balsamic's probably the best one to start with. You can put together a very basic sort of user interface for any app, really, or any website. And once you've created the basic user interface, once you've created sort of the best user interface for what you think your product will be, your MVP will be, you can show it. You can start showing it to those users, and you can see what they think to it. And you can ask them questions. You know, how would you do this? What do you think to this? And ask them different sort of ask their opinion on different aspects of this. And you show it to people, you see what their opinion is, you see what their feedback is, then you go back and improve it. You go back and improve the wireframe and improve the UI, and you do that 3 or 4 times. And then you're ready to build something. And again, don't do what we did and just charge straight into building the app, because we just built into the app. We went into building the app without really having put too much thought into the UI or anything. And it just wasted a lot of time, basically. So you can save yourself a lot of time spent coding if you decide what the app is going to look like and how the user interface is going to work, or the website is going to work, before you actually start coding it. And Balsamic and Adobe XD are really good for these. Then the next step is building the product. So just keep it simple. Use the wireframes. Try not to change too much from the wireframes to the actual product itself. If you're building an app, then you can work in close with your developer, your co-founder. Sorry, you want to do this part as rapidly as possible. So you want to get something in front of people as quickly as you can. And then the next step is, once you've built it, again, you want to get it in front of people. So you want to be physically seeing people use your product. Now, whether that's you're paying for a platform with which to do that, or you're just doing it on Zoom and they're sharing their screen, you want to watch people interact. And the way to do this is to have a number of different things you want to test before you show it to them. So with one person, you'll say, okay, test out this feature. I want you to try this feature, and I want you to give me your thoughts. Give me your thoughts aloud, and just watch them use it and see how they use it. And what will happen is you'll see they'll try and tap somewhere and the button won't work, and you think, okay, well, the button needs to go there. Or they'll try and scroll, and you'll start off with all the basic UI stuff and things to improve, and then they'll sort of go on to the once you've improved on that UI stuff, and you'll go on to the next aspect, which is the actual sort of the more of the user flow and how the product makes them feel. And you can just conscious of time, sorry. So yeah, just iterate and improve. Just do lots and lots of iterations as quickly as possible, and that's how you'll learn. You need to make a note. I mentioned that sort of innovation accounting. You need to make a note of each time you've spoken to someone and improved, and what that effect has had on new people. And you can use those email addresses you got people to sign up with on the landing page for these people. We had that slide, sorry. So I'll just very quickly talk about route to market. So we're a direct consumer, so users pay to a monthly subscription to use our product. We focused on a direct consumer route because we wanted to focus on building a product that users love, and that was a priority for us. We did think about going down the NHS route. Is this something we want to sell to the NHS? Let me tell you, if you want to sell something to the NHS, it is a huge amount of work, and it's very, very high friction. The sales cycles are 12 months to 18 months. You've got to find the right person to speak to. They usually won't buy anything without trialing it first, so you need to have a functioning product that you're happy to run a pilot with for them first, and it's just very, very difficult. And even if you can sell it to one trust, you've then got to, I know things are changing, but even if you sell it to one CCG, that's just one CCG, you then got to go and sell it to the next one and the next one and the next one. So selling to the NHS is, I would say, not a good early route to market plan. By all means, sell your product to the NHS, but sell it to someone else first. Validate it with selling it to consumers, validating it with selling it to small businesses. It's just very, very, very hard to sell to the NHS. It's just it's very, very complex organization. Oh, the other thing I'd say here is if your business model is saving the NHS money, again, it's your business modeling is going to become incredibly complex and incredibly difficult to understand, especially if you don't have much experience in business modeling like I did. Saving the NHS money is a very, very difficult business model, and it's very difficult to justify, and it's very difficult to get them on board. So I would, heed the word of warning. Selling to the NHS is a great thing to do, and it's a really good thing to aspire to. But early days, I think I would try and avoid that and have that for, once you validated it with another route, with a direct to consumer or a B2B route. Raising money. So don't raise money unless you absolutely need to. Build the MVP first. Try and validate the idea, because firstly it's incredibly time consuming. Secondly, you're probably going to fail if you don't have any traction. And the only sort of exception is if you're building something that you need money to build, like something that's going to be very expensive, like a new type of therapeutic or a new type of service. And that's when you can look into accelerators or grant funding. So we went through the Bethnal Green Ventures Tech for Good accelerator. So these accelerators all invest in your company, from a varying amount of money, and they'll take a certain percentage of equity. And then they have a sort of a 5 to 10, maybe 12-week program that they take you through. Accelerator is a really good way to sort of get you from idea stage, prototype stage to market stage. Obviously Y Combinator is the one that everyone knows. That's the most prestigious accelerator, and I would always try and apply for Y Combinator. You can do their program remotely. It's worth a try, and you'll get good feedback if you don't get in. But here are some other accelerators. Grant funding, really good way to get some non-equity, non-dilutive money. Prepare to be rejected. We've applied 3 times and we were rejected all 3 times. It's worth a try, but they're very competitive at the moment. They're called the smart grants. They're very competitive, and most people who get them have paid a grant writer to write them. So it's good to get help if you can, if you've got someone with experience in grant writing. Then Innovate UK is a great way to have money. It needs to be innovative. It needs to be in a high risk area. They won't fund, something that's a slight improvement. It needs to be something that's not been done before, or an area that's not been done before. And you need to have the money to pay for the project up front. Then they'll refund you at the end. So if your project's 50 grand, you'll need to spend the 50 grand first, and then you reclaim it at the end. Angel investors, best for pre-seed. You can get through an angel round quite fast. We've made some money from angel investors. You will need a bit of traction first. They're happy to take high risks. And finally, venture capital. Now you need to think long and hard. If you've got an idea if you've got a idea for a business that you want to scale, you've got to think long and hard about whether VC is right for you. It's not right for many people. If you're not targeting 50 million, if you're not targeting being worth 100 million, 200 million pounds in 5 years' time, then VC is not for you. They want high growth, high potential startups. So if your market is not in the billions, the VC is not for you. It's a lifestyle business. Or if you, sorry, I don't know, I've got 2 slides there. Yes, if you don't want to dilute your equity 20 to 30% each round, so if you don't want to lose too much equity, then VC is not the right thing for you either. And it just takes ages. You'll need to speak. So I think the success rate for companies getting VC funding is around 1%. So it's really tough. So we went through the Bethnal Green Ventures Accelerator and raised 70k alongside that. We launched our paid MVP after we'd gone back to the drawing board from the first MVP we had and done things properly. We launched that in December. We delivered 12,000 therapy sessions by March. We currently have a monthly recurring revenue of £700. We're still very early stage, and yeah, we've had a really good response so far from the business. It's been great fun. We've had some great testimonials and reviews. We're planning to raise a seed round later this year, so fingers crossed. But yeah, thank you. That's a pretty much whistle-stop tour of my experience and the lessons I've learned. Happy to answer any questions in the 3 minutes.
Thanks, Ed. That was again, really interesting, and I think just brings to life a lot of what we've looked at and gone through this morning, just in a sort of a real world example of, and thank you for being honest on some of the mistakes that you've made, because it is an important part of the process and that learning process. So I was told that to fail is a first attempt in learning. And I think that's a good way to look at it, because you often need to, get it not right to then learn how to get it right the next time. And you can obviously do that yourself or by learning from others such as yourself. So yeah, hopefully everyone's really enjoyed that. And I don't know if there are any questions in the chat, or if anyone wants to ask anything.
Thank you, Chris.
Next, what's your next step? Are you developing it or adding those features you took out?
No, we're not adding those features. No, they were the wrong features to begin with. So the next steps for us are we're just trying we need to validate the route to market strategy. So at the moment, we're not 100% sure. We've got the product that's doing quite well and that's growing, but we need to grow our user base significantly more than we are doing. We've got about 180 paying users at the moment, but we want to be getting to taking it to the next step with the product. We've built something that people are paying for and that people are enjoying. It's just sort of taking it to that next stage. So hopefully building some momentum this year, and then raising a seed round towards the end of this year to scale it internationally.
Do you envisage having to modify it for different markets, say in America or something?
No, so we've actually got a fair few customers. Probably about 50% of our revenue comes from the US at the moment already. I think the main modification we'll have to do for other markets will be changing the language, because the therapy is delivered in English. But we're focusing on UK English-speaking countries to begin with. So UK, US, Australia, New Zealand, South Africa, and then once we've sort of got a good foothold in those countries, we're going to go to Europe and probably translate it into Spanish.
It'd be well worth you having a word with DIT, because they might be able to assist you there. There was a lot of digital activity a few years ago with Australia and Canada. And invariably, I mean, obviously the trips, the tours at the moment are not happening, but there are a lot of virtual ones, and that would be a really good product and a way of, especially if you wanted distributors or anything, if you were going to do it straight over line.
Definitely, yeah, definitely. Thank you.
The other thing which we mentioned, which you might not have picked up, is there's a new ISO that's coming out for health and wellness apps. ISO 82304-2 in June. So it'd be worth you having a look at that. It's primarily around a lot of privacy aspects, as well as some other sort of safeguards they're building into it. I'll send you the links.
Yeah, please do. That looks. I've just googled that. It looks really interesting. Obviously, there's a lot of stuff going through at the moment. With we're just going through Orca at the moment. So hopefully we'll get. We've had an Orca review and we've got a few things to work on. So and then we'll go through DTAC as well, I expect.
Yeah. Good.
Thank
you.
Yeah. Thank you for having me, guys.
No, you're very welcome. Thank you for joining us. So yeah, I think that concludes the first bootcamp of the Entrepreneur Academy. So thank you for staying with us. So we've got the next half-day bootcamp on Thursday, so where we will be covering a lot of some of the things we've touched on today, but more detail on participant engagement, citizen engagement, with developing an idea. We've got the mid-tech guys, so James and Amandeep here, to be talking about IP and protecting that. We've also got Innovate UK discussing funding and sources of funding and things like that, and also PR company, We Are Liquid, that we use to discuss communication and marketing and how to sort of really get the most out of telling people about about your idea. So that's sort of the next stage on our pipeline of once we've discovered the idea, then developing it and getting it out there before we look at the real deployment stage a week today.